Did you know that the positions of the planets and the luminaries can literally tell you when it's the best or the worst times for a person to undergo surgery? Okay, so let's talk about it. Here are a few guidelines for planning surgeries or operations astrologically. Okay, so number one, you want to try to plan an operation 5 days before or 5 days after the new moon. Okay, so at this time, fluids are at their lowest ebb, and there is less chance of swelling. Okay. Number two, you want to avoid operations 5 days before or after the full moon. At this time, bodily fluids are at their highest, and this can cause excessive swelling or hemorrhaging or seepage from the wounds. Okay. So you want to avoid that. Number three, a day in which the moon is void is a bad day for surgery. Okay, so on days like this, there is a good possibility that the operation won't be performed correctly. Okay, that complications may arise or that a second operation will become necessary. Okay, so you want to avoid that. Number four, you want to avoid an operation on the part of the body which is ruled by the sign in which the moon or the sun is transiting. Okay, so if you didn't know, each sign rules a part of the body. So you want to avoid whatever sign that the moon or the sun is transiting. Number five, you want to avoid surgery when the moon is in a mutable sign. So this would be Virgo, Gemini, Pisces, or Sagittarius. You want to try to plan an operation when the transiting moon is in a fixed sign. So this would be Taurus, Leo, Scorpio, or Aquarius. Okay. So with these placements, the operation should go as planned, and the surgeon's hand should be steady, and no further complications should arise. Okay. Number seven, you want to avoid surgery when the transiting moon is square, opposite, or in conjunct the natal or transiting sun, Mars, Saturn, Neptune, Uranus, or Pluto. Okay, so when Mars is in a tension aspect with the transiting moon, this could cause excessive bleeding or inflammation after surgery. Okay, Saturn could mean chronic or very serious complications. Okay, so you want to avoid those. Number eight, you want to try to plan an operation when a transiting moon is sextile or trine to your natal or progressed or transiting Venus, Mars, or Jupiter. These aspects will help the surgery to go smoothly. Okay, when the transiting moon is sextile or trine to Mars, the surgeon will most likely have a quick clean cutting hand, and they will know what they are doing. Okay, number nine, you want to avoid surgery when Mercury or Mars is in retrograde. Okay, Mercury retrograde can mean misunderstandings, mistakes, and confusion. Okay, and since Mars is the planet of surgeon, when it goes into retrograde, surgeons tend to not be their steadiest or the most reliable. Okay, so they may not be able to concentrate well. Okay, and Mars in retrograde can also mean heavy loss of blood, heavy bleeding. Now, of course, sometimes surgeries are emergencies and you have to get it. You have to get it when you have to get it. But if you have the opportunity to plan or schedule ahead, these are things that you want to keep in mind astrologically.